Assalamu alaikum. I'm Dr. Abdul Wahab, Associate Professor, Department of Pharmacy, University of Science and Technology. I'm course instructor for the subject dispensing pharmacy, and our today topic is fundamental operations in compounding. So, as you can see over here in discussion outline, we will about the weighing, measurement of liquids, dissolution, filtration, mixing, size reduction, size separations. So fundamental operation in compounding and dispensing is concerned with the preparation of medicines from basic ingredients in small quantities, preparation of different dosage forms. But in compounding, we mostly prepare those dosage forms which are unique in nature. So as we have already discussed about the compounding in our previous lectures in detail, but over here we will discuss the different techniques, the different operations, on which, being a pharmacist, you should have a command and you should have the knowledge about all those techniques as operations. The accurate and elegant compounding of medicines requires expertise in several fundamental operations. For example, as you can see over here, weighing, measurement of liquids, dissolution, filtration, mixing, size reduction, and size separations. So these are the different fundamental operations for which expertise are required. Without expertise, you can't prepare the different dosage forms on small scales which are required for the unique need of the patient. So being a pharmacist, you should have the command, you should have knowledge all about these fundamental operations. Weighing, most important step upon which success of all these operations in pharmacy depends. It is the most important step because without weighing, you can't formulate any dosage form. Proper weighing depends on a thorough knowledge of balance, its principle, its care, and proper use. Similarly, during compounding and dispensing of medicine, weighing is carried out on a dispensing balance. All of you have been provided with such a balance. I know that you have experience that how to handle the balance, but over here there are some important points which should be cleared, that how to handle sensitive balances. When the load is placed on the pins of the balance, the horizontal metal beam moves around the central fulcrum, and deflection from the horizontal is indicated by the moment of pointer fixed in the center of the beam, which comes in the center when the weights in the top pins are equally balanced. Following techniques should be followed while weighing the medicinal ingredients. Place the balance in a very light area. So for the balance, there must be a light area free from dust, and place it over the rubber or sheet to protect the balance from corrosion. Similarly, adjust the level of the balance. Clean the balance pans with dry duster before use. Keep equal size piece of clean white paper in each pan and balance the pan. Place the required weights on the left hand side pan with the help of forceps so that sweat, dust, grease from hands may not make the weights inaccurate. So accuracy of weight must be considered. So for the accuracy, there should be no sweat, dust and grease on your hands. It means the hand should be cleaned. Close the drawer of the balance in order to prevent spoilage of ingredients on the weights lying in the drawer. Add or remove the medicament in the right hand pan with the help of the spatula until the pointer returns to the null point. Remember, in pharmacy, right hand pan is used for weighing the medicament. Understand? The right hand pan is used for weighing the medicaments, while the left side is used for the different weight pieces, etc. When the weighing is completed, put the balance beam again in fixed position. Transfer the weighed ingredients in a container or piece of paper as per requirements. Return the weights to the drawer with forceps and carefully clean the balance pan and the spatula. Return the excess left over ingredients to the stock bottle. After carefully reading its name on the label, similarly weigh all other ingredients. With the dispensing balance provided to you, the minimum weighable quantity is 100 milligram. Measurement of liquids. Measurement of liquid is generally done with the help of various cylindrical or conical measures provided to you, but the measures are preferred because it is easy. But the conical measures are preferred because it is easy to fill them without spoilage, to drain out whole liquid, to rinse out the residue after draining out liquids, especially viscous liquids, and also easy to clean them as compared to cylindrical measures. So you should use the conical measures instead of cylindrical measures, because the conical measures are easy to use and we can easily clean the conical measures, and we can easily fill them without spoilage, and we can easily drain out the whole liquids from the conical measures. The minimum measurable quantity is 1 millimeter. Using a 10 ml, conical measures up to 0.1 ml, liquid can be measured using a graduated glass pipette. Means that we can use for the measurement of liquid graduated glass pipette. Measuring technique for conical measures: always use clean and a dry measure. Always choose the smallest measure that will hold the required volume to be measured. Don't split the volume into two measurements, as this would double the error. Check the label of the stock bottle for the correct name of the liquid to be measured. Hold the bottle in the right hand with the label in the upper side. It is important. Hold the bottle in the right hand with the label in the upper side, so that it is visible during measurement, and also to prevent its spoilage if some liquid trickle down. Remove the stopper of the bottle and hold it between the little finger and palm of the left hand. Little finger and palm of the left hand. Straighten the conical measure with the graduated side in front and put it on a flat surface. Carefully pour the liquid into the center of the conical measure. and not on the side walls and measure out slightly less than the required volume. Let the liquid from the side walls of the measure fall into the center and then adjust the volume in conical measure to exactly the required volume. This precaution is especially important while measuring a viscous liquid like glycerin or oil. Similarly, hold the conical measure at the eye level and read the accurate volume to be measured with the appropriate graduations on the conical measure. Close the stock bottle. Recheck the name and volume measured out. Pour the measured liquid into the vessel in which the preparation is being made and thoroughly rinse the measure into same vessel. Dissolution. Another fundamental operation technique or step, that is dissolution. It involves dissolving solid into liquid to prepare a solution. It involves dissolving solids into liquid to prepare a solution. It is necessary to know the solubility of the medicaments into various liquids or solvents. The solubility of a liquid in a given liquid can be increased by some methods as given, like powder the solid into fine particles. How to increase the solubility of any solid liquid? This increases the surface area from which molecules can diffuse into liquid. By agitating the solution in a conical flask, which helps rapid dispersion of the solute throughout the liquid, and by increasing the temperature, which decreases the viscosity and increases the diffusion coefficient and also increases the solubility of the most drugs. Technique of dissolution. Generally, a conical flask is selected as a vessel for making solution because of some advantages as given. The contents can be easily agitated by shaking without any spoilage. As we have already discussed about the conical measures that we should use, conical measures instead of cylindrical. Because of all these advantages, the contents can be easily agitated by shaking without any spoilage. The content can be readily heated if desired. If there is requirement of heating, if heat is required, then we can readily heated the contents. We can easily heat the content readily. The contents can also be readily cooled under running tap water without contamination. There are some steps which are taken in dissolution technique. Powders the drug into mortar and weigh the required quantity of the powdered drug. Pour the drug with the lateral volume of the solvent in the conical flask and stir with a glass rod and agitate by shaking or by using a mechanical stirrer. Heat the solution if needed and obtain a clear solution. Bring the solution to room temperature by cooling. Transfer the solution to a conical measure and add more solvent to make the required volume of the solution. Transfer the solution to a conical measure and add more solvent to make the required volume of the solution. Filtration. It is also fundamental operation technique. Filtration is the process by which the solid particles are removed from liquid or gas by passing it through a porous medium which retains the solid particles but allows the liquid to pass. The rate of filtration can be increased by some methods which are given as increasing the surface area of the filter. The rate of filtration can be increased by increasing the surface area of the filter, reducing the viscosity of the liquid by heating the liquid, increasing the pressure across the filtering device either by applying vacuum below it or by increasing the pressure over the liquid being filtered. Means by increasing the pressure across the filtering device. Similarly, by using high porosity filtering medium such as centered glass filter or membrane filters, generally a number 3 filter is used for small volumes for filtration by gravity and number 4 filter for large volume by vacuum or pressure. If we are using vacuum or pressure, then we should use filter number 4. So in this case, vacuum or pressure will be required. Centered glass filters are made from borosilicate, very expensive, not used in pharmacy lab or for routine use. A high degree of clarity is required in case of oral solutions and solutions for application to skin or mucous membranes or ulcerated areas. It is necessary to adjust solution to volume through the filter as wash thorough the filter using a little of the vehicle and discard the washings. Make the solution to volume and pass through the filter into a measuring device. Rinse through the filter with a sufficient quantity of vehicle to make the final required volume. Mixing and mixtures. Many pharmaceutical preparation consists of homogeneous mixtures of two or more components. And depending upon the components, the mixtures are divided into 4 classes. And depending upon the component of the mixtures, depending upon the components, the mixtures are divided into 4 classes. Mixtures of liquids, mixtures of liquids and solids, mixtures of solids, mixture of semi-solids, and mixtures of liquids. These are of 2 types. A homogeneous mixture, first one, homogeneous mixtures of liquids called solution contain readily miscible liquids. A mechanical stirrer or glass rod may be needed to mix them. Sometimes an electric stirrer may be needed to mix liquids of high viscosity. Heterogeneous mixtures of liquids are emulsions. These involve mixing of 2 immiscible liquids with the help of suspending agents or emulsions, and by local mixing in which hair is applied to the globules of liquids in a mortar and pestle on small scale. Mixtures of liquids and solids. These are also of 2 types. Homogeneous mixtures are solution. It involves simple dissolution of soluble solid into liquid, which may be achieved by shaking or stirring. Heterogeneous mixtures are suspension. In this variety, the dispensed solid tends to separate from dispersion medium, so proper mixing is required to obtain a stable suspension. This is generally done using a mortar and pestle at small scale. So the use of pestle and mortar is important for the preparation of such type of mixtures, homogeneous mixtures and heterogeneous mixtures. It involves mixtures containing semi-solids. It involves mixing a solid or a liquid into a base consisting of one or more semi-solid, for example, ointment, paste, suppositories. The following procedure is adopted. In this case, prepare the base of ointment or paste which may contain liquids such as liquid paraffin, semi-solids such as whole fat and soft paraffin, and also solids such as cetosterol alcohol and hard paraffin. The ingredients are melted together in a dish over a water bath and stirred well, taking care to avoid overheating. This is done to obtain a homogeneous mixture. Incorporate any solid ingredients by first rubbing them into a small quantity of the base. The rest of the base is added gradually and mixing continued until the medicaments are thoroughly mixed. Incorporate, third step, incorporate any liquids with base after cooling it to the room temperature. Volatile liquids and heat labile liquids should not be added until the temperature of the base is below 40 degrees centigrade. The solids and liquids ingredients are generally added with the base on large warm tile using a flexible spatula or in a warm water using pestle. Size reduction. Size reduction or comminution is the process of reducing drugs into smaller pieces which may be coarse particles or fine powders. The advantage of size reduction are promotes mixing, promotes suspension, facilitates dissolution, increase rate of absorption from git, yields preparation suitable for use on mucous membrane or skin because it prevents grittiness and irritations on application. On small scale, this is achieved by the processes of dry grinding and wet grinding or ligation. Dry grinding it involves breaking the ingredient in a mortar and pestle. Size reduction is done by compression between the flat head of the pestle and bottom of the mortar and attrition by shearing action of the pestle. Wet grinding or ligation. This involves preparing aqueous suspension. The ingredients are made into paste with water and ground in water. In case of preparation of semi-solid preparation, the medicament is rubbed on with the warm base on a warm tile or in a warm mortar. Size separation. Size separation is done to separate particles of the specialized size from a medicament by sifting. Generally, wire mesh sieves are used. For dusting powders, fine powders are passed through the apertures of 180 micrometers, number 85 cv. For all powders for external use, mesh size 250 micrometer or cv number 120 is used. For abrasive tooth powders, number 67 is used. Labeling of dispensing medicaments. The containers containing the dispensed medicament is labeled, providing adequate information so that the medicines can be taken or used properly. The information on the label should be accurate. It should be checked after writing and rechecked before pasting it on the containers. It is must that the label must be accurate. How to ensure accuracy? It should be checked after writing and rechecked before pasting it on the container. Legible. The label must be legible, intelligible and unambiguous, adequate and relevant. Labeling of dispensed medicines. Cautionary and advisory labels. For external use only, it should always be applied to all preparation meant for external applications such as gels, lotions, ointments, creams, pastes, dusting powders, gargles, antiseptic lotions, skin protectives and emollients. The label should provide following information. Preparation of the label. The label should provide following information: name and address of the patient, name and address of the supplier, date of supply, precise details regarding contents of the dispensed medicines such as name of the medicine, the strength of the medicine, the quantity of dispensed medicine is given in a whole number and always putting a zero before each decimal quantity. It is must to put zero before each decimal quantity. Storage condition and shelf life of the preparation in relation to temperature, light and humidity. Instruction to the patient, directions and method of taking and using the medicines as given in the prescription by the prescriber. It is better to use phrases such as to be taken, to be given or to be applied instead of take, give or apply. The direction written on the label of dispensed medicine should be simple and without any confusion. The direction should be simple and without any confusion. For example, shake the bottle for emulsion, suspensions and aerosols. For external use only, take with water. Cautionary or advisory labels. Cautionary instructions: not to be taken or swallowed. It has to be applied for all those preparations which are meant for internal use only, but not to be taken orally. For example, for rectal use only, for rectal preparation, for vaginal use only, for vaginal preparation, for nasal use only, for nasal preparations. So these are cautionary instructions which must be written on the label. So it was all about the fundamental operations in compounding. Thank you so much. God bless you.